Hi, Renee. The nurse asked me to come in and assist you with transferring from bed to wheelchair, okay?
Okay.
I'm going to get what we need and we'll get started.
Okay.
Now, we're getting ready to actually assist Renee with transferring from bed to wheelchair. And before we start, of course, I want to show you the equipment that's involved in that. You're going to need, of course, your gait belt for transferring her over. And we're going to also need a wheelchair. Now, one of the things you want to make sure of is that you understand how your wheelchair operates, meaning how the wheels fold up and how to lock it. Again, in this skill, there are many before steps. Meaning before you stand your patient up, that you must do prior to standing your patient, not after, in order to get credit. So you want to make sure you know how your wheels lock on your wheelchair. So in this wheelchair, for instance, to lock the wheelchairs, you push down on the handle. There's one on both sides to lock the wheels. The footrest, you want to make sure that you fold those up prior to standing your patient, before you stand them, for safety reasons. Even on this wheelchair here, we can actually move the legs out the way even more to get them out the way. You also want to make sure that you have non-skid footwear for your patient to put on. And then we also want to make sure whenever we get ready to position Renee in the wheelchair that it's facing the head of the bed, facing outward. So we'll put it there. Now also, you want to make sure that your wheels on your bed are locked. So you want to go over here and check to make sure that the bed wheels are locked. So you want to do that on test day. Make sure you do that. Don't just say it. You have to actually demonstrate that the bed is in a locked position. Now, one of the things I'm going to go ahead and do prior to standing Renee up is kind of move this over a little bit. And go ahead and lock the wheels. I'm going to fold up these footrests. Move them out the way even more. Now, when I get Renee to sit up, I'm also going to make sure that I bring the wheelchair a little closer to the bed. I'll wait till she's sitting up before we do that, because you want a small amount of space here when you're transferring your patient over to prevent them from falling. Okay? Now we're ready to start with the sitting position. Renee, I'm going to actually assist you with sitting up again, okay? If you would just sit up. Now it says assist, so that means you need to make sure that your hands, even though they're alert and oriented, that your hands are on them. So we're going to assist her to sit up. We're going to assist her in a sitting position. If you'll bring your legs around for me. There we go. We're going to put her shoes on before we stand her up. Okay, and Renee, I'm going to get you to slide down this way just a little bit, because I'm going to bring your wheelchair a little closer. And then I want you to put your feet flat on the floor for me. You want to make sure that before you stand them up, their feet are flat on the floor as well. We're going to go ahead and kind of move the wheelchair a little closer to her. Don't let me hit your leg, okay? And some things you just have to gauge in the process of actually doing it, because again, it just depends on where your patient is in the process. Make sure that those wheels are locked, because that is your critical or highly important step in this skill, okay? Before we stand her up, we're going to make sure that we have the gait belt on her. Okay, I'm going to put this around you, okay?
Okay.
Again, we're going to go through here on this gait belt, through the rugged end. We're going to put it more to the side, keeping our hand in between. We're just going to put it on like a belt. And make sure you tighten it up. Okay. Now, this skill also asks that you give your patient instructions prior to standing, so that they'll know what they're to expect in regards to the transfer. So again, I'm going to give some instructions to Renee before we start. Renee, I'm going to have you put your hands on my shoulder, okay? I'm going to block your feet with mine and my knees with yours.
Okay.
And I'm going to grab your gait belt on both sides.
Okay.
And we'll count to 3, and I just want you to stand up for a moment.
Okay.
Once we stand up, I'm going to slowly turn you, and I want you to just stand facing with your legs back here. Okay. And on the count of 3, we'll sit. Okay? All right, so we're going to block her feet. And again, remember, the key is to keep her from sliding, but you definitely want to make sure that you're blocking and protecting her stance, and that you're facing her. Don't stand to the side to help her stand up. We see people do that sometimes. You want to make sure, if you're the only person that's standing this person, that you're facing them and you're doing that. Some of your patients may require that it takes more than one person to stand them or transfer them. Some of your patients may even need mechanical help, like with a Hoyer lift. In this case, though, we're just doing transferring from bed to wheelchair with assist, so she can help me. Okay? Now, if you'll put your hands here, I'm going to grab the gait belt on both sides in an upward position. We're going to count to 3,
Okay.
and then we'll stand.
Okay.
You ready?
Mm-hmm.
1, 2, and 3. Good. Again, when we stand, we want to make sure that our gait belt is nice and secure. Okay? Now, if you'll just turn slowly with me to the chair. There you go. Can you feel the wheelchair? Okay, you want to block their feet, and then on the count of 3, we're going to sit down, okay? And you're going to bend with her. 1, 2, 3. Now, one of the things you want to make sure of is that they're in an upright position. You want to make sure that the hip is sitting at the back of the chair. That's part of a step. Are you back far enough? You good? Okay. We're going to also make sure that we put her feet up on the footrest. You bend your leg for me. There we go. I'm going to unlock this a little bit so that we can move this out to get your foot on here, okay?
Okay.
Bring the other footrest around. There we go. You want to also at this time remove the gait belt. We don't leave the gait belt on our patients because you may need to use this gait belt down the hall with another patient, okay? But whenever I have to put her back to bed, I will use it. Okay, and I'm going to take this off. Remember, we don't just pull it off. We lift it up. Okay, and she's okay here. All right, Renee, I'm going to give you your call bell. Okay. Let me come around so I can make sure that I can give it to you properly. Okay. You just call us if you need us. And I'm going to, of course, straighten up your bed. On test day, you want to just leave them sitting in the chair. It's fine. Okay. And once you have them up in the wheelchair, they have their call signal. You'll say to the evaluator, I will now wash my hands, and this skill is now complete.